The injection of the lips today. Can you see that? This is my patient, and she is 57-year-old, and I will show you an injection on the lips and perioral areas. You can see the aging process around the lips. We can have a landmark when we want to see with the ricket line here, and you see that she requires volumization on the lips. So I will use the Prolenium product with the vermilion injection, the border, and the perioral area. I'm sorry because I hear my voice and it's not comfortable to speak. I'm sorry for that.
We can hear you very well, so don't worry about that.
Okay, thank you. So now I will show you a cannula injection. Okay. The insertion point at the commissure of the lip. I will use the Prolenium Versa. Now it's much better because I can't hear my voice. And I use the Easy Guide from Softfield Company. I use the cannula. This is a 25 gauge, 5 centimeter cannula. And I use the Prolenium Versa. The Prolenium Versa is a product very adapted for lips injection because we don't have a high hydrophily, so we avoid, with the quality of this product, we avoid a maximum of inflammation. Now I am injecting the vermilion. You can follow the cannula here, and you can see where I am injecting just under the mucosa. You see here the layer of my injection and the tip of the cannula.
Sandrine?
Oui?
Can I ask you a question about the entry point you choose?
Yes.
Is it always the same location? Do you have a landmark to fix this point, or you can change according to the lips, the project you have?
Yes, Fred. Usually I use the same point of injection. It depends of if I want to inject only the lips, or if I want to inject the lips and the nasolabial fold in the same time. So usually I use a point located 5 mm from the commissure. This is what I made here, around 5 mm from the commissure of the lips, in order to consider the whole area. I mean the perioral and the upper and lower lip in the same time. So I use usually, I work in aseptic condition with sterile gaze and sterile gloves. Here I am injecting with you see the red dot on the embasis in the upper side in order to inject very superficially and to control the injection of the vermilion on the lips. After that, this is the first step. After that, I just model the lips. In the same time, I am injecting, and now I continue the injection here. And you see the projection of this product is very, very interesting because we have a result, an immediate result, and what you see, it's what you get after the injection. You will not have inflammation after injecting. After that, I consider the vermilion border. You can follow the tip of the cannula. Here, you see this tip running along the vermilion border. And I put the red dot up in order to control and to have a very precise gesture and result. I inject the border now with a retrograde injection, okay, like that. You see the difference between the side treated and the side not treated. We see the beautiful projection, but not too much. And I now I inject with the same entry point the vermilion of the lower lip, and I follow the injection with a very simple retrograde injection in a very superficial way concerning the anatomy. You have to respect a very superficial injection in order to avoid to inject through the artery. Now I have injected the lower lip. I continue my injection. I can go back like that, and I follow the vermilion. I have injected the half syringe, I mean 0.6 ml, because the syringe contains 1.2 ml. Now I inject the contour here. You see, you can follow the tip of the cannula. You see here the tip, and I raise the tip to be very superficial. Now I inject the vermilion border, but I stop before the commissure in order to have a very artistic result and very natural. After that, I need the kiss. I will inject the ravenous kiss, which is very adapted for the white lip. And with the same entry point, you see, I stretch the skin with my left hand, and I follow a very superficial way. And my goal here is to fill this area, but in the same time, I want to break the safety in order to have a very good distribution with my product. My product is ravenous kiss, and the particularity of this product is to be very pure without BDD in excess. So like that we can have a very, very interesting result, very natural without inflammation. And we have a dialysis of the product for 7 times before inserting the gel in the syringe. And this dialysis, create a very pure gel, as you will see at the end of my injection.
Sandrine, in your technique, you make a very natural lips at the end, very artistic. But if you want to obtain the verticalization of the lips, do you use the same horizontal injection, or you use a needle injection, or you change the angle of your cannula to verticalize the lips?
It depends. Usually I keep the same kind of direction and entry point, but I move the orifice of the cannula. I show you. I go into the lips, okay, like that.
Can you
and
zoom?
if I want to verticalize, I push my product. Look at the embasis and the red dot. I push the product and I move in the same time the cannula like that. You understand?
Yeah.
So when you do that, you push the product in a vertical way. So now this patient is very natural. She wanted natural lips without side effects, without,